WJR.
Let me introduce you to the Chief Medical Officer at St. Joseph Mercy, Oakland, Dr. Donald Bignotti. Good morning to you, and I suppose I should mention that we are talking about colorectal cancer, and this month set aside to make everyone aware of it. What is it?
Well, first, thank you for allowing me to be here with you today. Colorectal cancer is, as you mentioned, the second leading cause of cancer deaths, third leading cause of cancer. It impacts about 5,000 people in the state of Michigan on an annual basis and is the cause of death annually in Michigan for about 1,800 people. This is a serious problem. Colon cancer is the appearance of a cancer somewhere in the lower part of your digestive system, including the rectum, which is the last 6 inches,
Right.
and the colon before that, which is about the last 4 to 5 feet. As you mentioned, it is very treatable, particularly if it's picked up early. What we're trying to do with March is to make the public aware that this disease is treatable and is something for which we can adequately screen. Screening has been the most significant improvement in the treatment that has happened in the course of my career. And there are a number of different screening methods. What we're electing to go with is one of those.
And we'll talk a bit about that, but who gets colorectal cancer?
Well, the strongest risk factor is age. So those of us who are mature adults over the age of 50 have an increased risk. Those people who have a family history are at an increased risk. Those people who have colitis, as an example, are an increased risk. And
Right.
there are a few other conditions which increase your risk for polyps that can also do that. But those are the major risk factors right now.
More men than women, or can both get them?
Both can get it. This is a disease that is relatively equal for each gender.
What about the symptoms?
Most patients don't have symptoms until relatively late in the disease. That's why we encourage screening. The symptoms, when you get them, generally tend to be bleeding in the stool.
Right, okay.
Blood that you'll see in the stool. But you can have blood in your stool without being aware of it or being able to see it. When the disease is more advanced, you can have pain, cramping, change in bowel habits. You can have a change in the character of the stool. Sometimes it becomes very narrowed because of the presence of a cancer. Or just otherwise a change in your stool habits.
And what about losing weight? Is that another symptom? All of a sudden you can't figure out exactly why you're getting so thin.
That would be, relatively speaking, a later symptom. So hopefully we're picking it up before people begin to actually lose weight.
But what's really a key here, Dr. Donald Bignotti, as we talk about colorectal cancer, is that there can be, and you just ticked off the symptoms and alluded to the fact that there might not be any. So this may be developing, and an individual over 50 especially may not be aware that it's taking place in his or her body.
That's exactly correct.
So what do they do?
Well, what we encourage people to do is to get screened, and the American Cancer Society has a number of screening techniques and guidelines that are out there. What St. Joe's Oakland is doing is to make available to the community 4,000 test kits. The method that we're using is a type of a test that looks for elements of blood in your stool. And what happens is you do this test in the privacy of your own home. You send in the sample to St. Joe's. We will go ahead and test it. If it is positive for blood in your stool, we will contact you. We will contact your physician. If you do not have a physician, we will set you up with a physician to help follow you through this process, and we will make sure that you are going through not just the screening, but that you get hooked into a system to make sure that, should, God forbid, there be a problem, that is picked up and followed.
So this is absolutely free of charge, and you want, what, our listeners doing this at least once a year?
If we're going to recommend that people use this test to pick up blood in your stool, that should be done annually.
Okay. What about a couple of other items here? And then we'll tell our listeners what they can do or where they can go to get these free test kits. But this sigmoidoscopy, it's easy for you to say as a doctor, probably not so easy for me. And there are those who tremble at the thought of having that done to them because it's what, this flexible lit tube that is inserted inside you?
A colonoscopy is a
What's the difference between a sigmoid and a colonoscopy, by the way?
distance and discomfort, I guess.
I see.
The two Ds.
Which is the easiest or the least, I don't want to even say painful, but disruptive to your body?
I would say that as far as disruptive to your body, they're probably equally disruptive.
Yeah.
The thought of having a instrument inserted up your backside is probably uncomfortable as a thought, irrelevant of distance.
But the colonoscopy, it seems to me, when inserted, can remove, if found, the polyps that can cause the cancer that we're talking about here.
And
right?
that's true whether or not we're talking a sigmoidoscopy or colonoscopy. So most people, when they have a colonoscopy done, have it done with some level of anesthesia so that they're sedated, and so they do not recall the experience. That is a definite plus.
Right. The kits sound far more comfortable, shall we say?
Well, it's easier on the patient. It is less costly. Colonoscopy is a safe procedure, but it does have some risks and potential complications. And fortunately, they happen to a very, very few percentage of the people who get it. But if you're talking about doing a lot of people, it becomes expensive. It becomes a fact that some people will have complications from the testing who didn't necessarily have other positive results. So there's quite a controversy about which is the best way to screen a large population. Doing the colonoscopy or sigmoidoscopy does have the advantage of being able to remove polyps if they are present.
Right. So before we run out of time here, Dr. Bignotti, the way for our listeners to get these free test kits, what do they do?
Well, you can go out to MichiganMedicalReport.com, and it will give you a list of the different sites, and there's also an 800 number there that you can call that has the ability to connect you with somebody who can send you a kit.
Or they can call, what, is there a 1-800-372-6094 number as well?
Correct, that is the number.
All right, we've got it. We've taken care of it. We're making sure our listeners are up to speed on how they can prevent this from happening. As you suggested, 90% curable with the proper treatment. This is one treatment. Thanks for joining us. Appreciate it.
Thank you for the time.